All right. Well, let's go ahead and get started. Welcome this evening to New Jersey Medicare 101. My name is Jamie Sholem, and this is Ethan Sholem. We're going to go over the basics of Medicare tonight, and we appreciate that you joined this webinar, and I think you guys are all going to learn a lot from it. Little background before we jump in. New Jersey Medicare 101 is part of a national organization called USA Medicare 101. It's a nonprofit organization, and they work through local agents and agencies like we are with Senior Star Insurance Group, but just to get the word out, just to do some education on Medicare. It's a very layered and complicated process, and it's something that we like to talk to people about. Just a little also about our background is that I've had 10 years in financial planning, and specifically with Medicare planning at the front of it. It always starts with Medicare planning. We are specialists. I opened up Senior Star on my own 8 years ago because the companies I was working for prior to that were only offering one type of Medicare plan or the other. And I wanted to give my clients all of the options. So very, very happy that we opened up Senior Star. We're located in Old Bridge, New Jersey, and we've helped thousands of people either with education on Medicare or to enroll in their own plans. About 3 years ago, my son Ethan joined the firm, and I'm going to let him introduce himself and take it over for a few slides.
Hello, guys. I'll keep it short because I'm not super interesting. But yeah, about 3 years ago, I joined Senior Star Insurance Group after working some corporate jobs after college. And I'm very happy that I did. I'm licensed in 10 different states, contracted with all the major insurance companies in those states. And I'm excited to help educate you guys today about Medicare. So let's get started here. Today is just about the facts. Right? I mean, if you're anywhere within a year of turning 65 or maybe retiring soon, that's probably why you're in this webinar. And you're probably getting your mailbox full of junk, and you may not know what all those mailers are. They try to confuse you a little bit. If you're turning 65 soon, your neighbor's telling you one thing, your cousin's telling you another. You might be getting cold calls. Today's just the facts. It's just about the structure of Medicare and your options and your timing, okay? So we're not promoting one specific way to be on Medicare or one specific plan or company. What are we going to go over today? Let's go over an agenda. Well, first, we're going to talk about the different parts of Medicare, the A, B, C's, and D's. You're going to know what those are in about 10 minutes from now. We're going to talk about the Medicare deductibles and the premiums. How much does it actually cost to be in Medicare? How and when to enroll in Medicare. Do you have to enroll in Medicare now, or can you wait? If you do have to enroll in Medicare now, how do you actually do it? We're going to talk about late enrollment penalties and how to avoid them. You guys are doing a good job by being on this webinar, so you're probably going to avoid them, but we're going to make sure you know what the implications are. We're going to talk about Medigap plans, also known as Medicare supplement plans. Those terms are interchangeable, and we're going to compare them to the Medicare Advantage plans, also known as Part C of Medicare. A lot of interchangeable terms in Medicare. They like to confuse us, but we're here to help that confusion, clear it up. We're going to talk about the benefits of using an independent agent very briefly. We're independent agents, and we believe in the service that we provide. So it's a $0 fee to talk to an independent agent or use them for an enrollment. So we're just going to give you a little bit of lip service on what that service looks like. And then next steps. You guys are doing the right thing right now. How can you continue to educate yourself to be ready when the time comes? Now, there's a lot of people in this chat. We're excited to teach you guys all about all about Medicare here in this webinar. Now, there's a chat which allows you to ask questions publicly, and there's also a Q&A. So you can ask questions either way. The Q&A is private. The chat is public. Because there's a lot of people, just for the smoothness of this workshop, we're going to wait to answer the questions at the end. But we will have a Q&A at the end as well. So feel free to put your questions in the chat or Q&A, and we're going to hold off, and we're going to answer them at the end. but we're definitely going to get to all of them. We promise you that. Let's get started.
All right. Let's talk about Medicare. 4 parts of Medicare. The first part is hospital coverage, or Part A. It just talks about what you're admitted overnight for, whether that be in a hospital or a skilled nursing rehab facility. And then there's Part B of Medicare, which is what they call medical insurance, but it's the outpatient care. It's your doctor visits, diagnostic tests, same-day surgeries, etc. If you have any sort of in-office therapies, transfusions, chemotherapy, anything that you're not admitted overnight for is Part B. But as you can see on the screen, Parts A and B don't cover everything. Together, those 2 parts of Medicare are called Original Medicare. But, and we'll get into this in detail in the next few slides, it doesn't cover everything. There are deductibles if you should be admitted into the hospital on Original Medicare. And then on an outpatient basis, you pay 20% for everything you do. So there are some risks if that's all you have. In addition to that, it doesn't cover drugs. So we've got to find a way. There's 2 ways to do it to get you drug coverage. There's Part D, referring to the drug coverage. And then finally, this is out of order on purpose, Part C of Medicare is a different kind of Medicare. It's a privatized version. It's where a private insurance company takes over for Medicare, rolls in Part A and B and then D into one little bit more simplified plan, but you're in a private insurance company. So those are the 4 parts of Medicare, but you should know Part C is a completely different way to be in Medicare. Now, we're going to go over the costs for Original Medicare in Part A and B. First, let me tell you that if you have the other kinds of coverages that we're going to talk about tonight, this will not necessarily apply to you. But if you don't have any of the other coverages, this is what you would be exposed to. So on Original Medicare in Part A, most of you, if not all of you, are not going to pay a monthly premium. You're not going to pay a rate to be in Part A, because if you or your spouse have worked 10 years or more, 40 quarters, which is 10 years, you will have no premium that you need to pay for Part A, as long as you paid those taxes. That said, it's not necessarily going to be free to go to the hospital. If you go to the hospital with Part A on Original Medicare, you're going to have a deductible from day one of $1,736. Now, that deductible is for the first night all the way through the 60th night. And if you're in the hospital for 34 nights, not terrible to come out with a $1,736 bill. That's okay. However, if you have a very long-term hospital stay on Original Medicare, it gets kind of ugly. After the 60th day, from 61 to 90, that deductible turns into a daily deductible of $434. Then, after 90 days, 2 things happen. First of all, your deductible doubles again, and it's now $868 a day to be in the hospital. And they start to remove lifetime reserve days for hospital stays. Medicare gives you 60 extra days, lifetime reserve days beyond 90 days in any given year, that they will start to remove. For instance, if you were ever in the hospital for 100 days during that year, well, now you've paid all that money to get to the 90th day in deductibles, and now you only have 50 lifetime reserve days. Now, that's going to come into play when we talk about the other coverages, so just remember that. It is possible to be in the hospital for those long stays, because if you are admitted to a hospital, let's say for 10 days, and then you're discharged, and 45 days later, you need to go back to the hospital, there's a complication. Well, now you're on day 55. You don't have to be physically in the hospital for 90 days. The reason is, if you are not out of the hospital for a full 60 days contiguously, then you're in the same benefit period, and those days will count towards those daily deductibles. So just keep that in mind. Now, if you are discharged, it's not uncommon to be discharged from a hospital stay of 3 nights or more. You might need some inpatient rehab at a skilled nursing facility. Well, the first 20 days, you don't have to worry about it. That's on original Medicare. But if you have a need to be in an inpatient rehab from 21 through 100 days, you're going to pay a $217 per day deductible, again, with the daily deductibles. And it's not unusual to need a 30-day or 32-day rehab stay or longer. So this can come into play for people as well. And original Medicare has you exposed to those longer term skilled nursing stays. Now, if you needed home health care, there's some not minimal, I should say, but limited home health care that would be prescribed to you for a doctor after a hospital stay if you should need a certified home health aide, or if you need physical therapy or something like that at home after a hospital stay. It'd be limited in scope and in length of time that it would be provided for you, but you wouldn't have to pay for it. And then finally, if you do need inpatient hospice care, well, you don't have a copay for that either. Medicare has that covered. Now we're going to switch gears. We're going to talk about what would your costs be in original Medicare on an outpatient basis. Well, first of all, most of you are not going to have your outpatient Part B of Medicare for free. It will be a premium. Most of you are going to pay $202.90 a month. There's two ways that can be different. First way is if you have Medicaid, if you have low-income subsidy known as Medicaid, as well as Medicare, you can have both at the same time. They will waive that $202.90 and you'll pay nothing for Part B of Medicare. And on the other side of that, if you are a high income earner, you're going to pay more than $202.90. And we'll talk about what that means. What does a high income earner mean? At the end of the presentation, we have a slide that will describe that. But that surcharge is called IRMA, Income Related Monthly Adjustment Amount. And if you make enough money, the government will charge you more. As I say, we'll show you those amounts later. Most people pay $202.90. Now, there's also on Part B of Medicare a deductible. There's an annual deductible for everything that you do on an outpatient basis. Well, it's $283. That's not terrible. I think most of you might be on plans that have deductibles far higher than that. But it is there. It is a deductible for outpatient services, and it will factor into your coverage, and you need to know about it. So after you get done paying your monthly premium and you get through that $283 deductible on original Medicare, you then get to spend 20% for everything you do on an outpatient basis. And there is no cap. There is no maximum out-of-pocket protection. If your bills add up to $100,000 a year for your outpatient care 1 year, you're paying $20,000 of it. So here's what you're exposed to in original Medicare, Part A and Part B. And don't forget, I haven't talked about drugs yet. So what do people do? How do people fend off these costs? You thought Medicare was going to be more than that. Well, there's two main ways that people go down, two pathways to deal with those costs that original Medicare would expose you to. The first I call the government path. So we're going to leave that original Medicare card, your Parts A and B. That's what the cards actually look like right there. You're going to leave that as your primary insurance. That's going to lead the way. It's going to pay the first. It's going to pay that 80%. But then you need to fill in the gaps. We just talked about all those costs you might be exposed to. First thing we're going to do is add a standalone drug plan, a Part D plan. There are 12 plans in New Jersey that are standalone this year. How do we choose them? Well, we take our clients down a simple path of finding out what meds you take on a daily basis. We find out what company has them and what plan has them for less at the pharmacy you like to go to. It will have a monthly premium. Depends on your drugs, whether that's going to be high or low. But you have that plan as a standalone. And then you're going to add a secondary health plan. And it's going to either pay all of or most of those costs that we just talked about for in-hospital and outpatient medical needs. It's called a Medicare supplement plan. It's also called a Medigap plan. They're interchangeable terms, mean the same thing. And so then you have that coverage. Now, most people look at this and they go, it sounds kind of confusing. You have 3 separate cards doing different things. You have 3 separate monthly premiums, confusing, expensive. Why would anybody do it that way? 2 main reasons. If you have Original Medicare as your primary insurance, you are no longer in a network. Original Medicare leads the way, and that opens the door to any Medicare provider, hospital system, doctor, lab in the country. Doesn't matter what your secondary your secondary Medigap plan says. It doesn't matter what company you have that with. It could be a company your doctor's never heard of. Doesn't matter. If your doctor or provider takes Medicare, they take you, and they'll take you with whatever secondary plan you have. Immense freedom, probably more freedom to choose a provider than most of us have ever had. The second reason that people like this pathway is because you're going to know what your costs are for that year. Medicare is taking 80%. The Medigap plan is taking the 20%. That's true if you go to the doctor a lot or have a lot of tests, hospitalizations, or if you just go to the doctor 4 times a year to get your meds, re-upped. So it's the comfort of knowing what your costs are going to be and freedom to go wherever you want. That's why people choose this pathway. On the other side of it, the other way to be in Medicare is to have a private insurance company take over. I call that the private path. And it's an all-in-one plan that will take in your parts A and B and D. It has drug coverage in it. You will still have to pay your Part B premium. Yes, you will. That is a prerequisite for anything you do in Medicare at this point. You're going to need to pay that Part B premium from now on. Whether it's got an IRMA surcharge to it or not, you need Part A and Part B to get into it. But once you go into this plan, it's all in one. So your drugs are within these private plans that are also called Medicare Advantage plans. It's also called Part C of Medicare. And they will have drug coverage within them. You don't need a separate card or a separate premium for the drug benefits. You will also have other benefits that are included in this pathway in most plans that you will not find in the government pathway. Things like dental coverage, vision coverage, meaning for eyeglasses and corrective lenses, hearing aids. Many of them will give you over-the-counter benefits where you can go to the drugstore and they will give you vitamins and they'll give you other items for free that the plan actually pays for. It's a managed care plan. You will be in a network. There used to be, well, there still are plans where you can go out of network for more, but those plans called PPOs are becoming less frequent and more expensive to go in. There are HMOs where you have to stay in the network. But here's the thing. Some of these plans, not all of them, some of them have no monthly premium. So you would be paying for your Part B every month, but you would not be paying for these plans. Mindful of the fact that you got to stick to the network. You will have co-pays for the things that you do as you do them. If you have a doctor visit, it might cost you a certain amount of money. If you have an MRI or a hospital stay, it will cost you a certain amount of money. We're going to get into these details more as we move forward. But these are the 2 main pathways that people choose to be in Medicare. Okay, we're switching gears. We're going to talk about time, enrollment deadlines and time periods here. When you're turning 65, if you are already taking Social Security, you don't have to do anything. You're going to get your Medicare card with A and B on it about 3 months before your 65th birthday. That's only if you're taking Social Security. If you're turning 65 and you want to go on Medicare and you are not taking Social Security, you are not going to get your Medicare card automatically. You've got to let them know. You've got to let the government know, I want my Medicare to start. You have a 7-month window to do that. It's 3 months before the month of your 65th. It includes the month of your 65th birthday, and it's 3 months after that. In that time period, you can get on Parts A and B of Medicare, which is a prerequisite. You can get a standalone drug plan and a Medigap plan, or you can go the other way, and you can get a Medicare Advantage plan. All without delay, without any health questions, and without any penalties. It's an open period. We can make any decisions you want. And it's a great, great time for people where they have the power of choice. Okay. So what if you're 65, you're still working, or you're on your spouse's plan who's still working? What happens if I like my coverage when I'm 65 and I don't want to go on Medicare? Well, you might not have to. It depends on a few things. If you are on a plan through work or spouse's work that has more than 20 people on the plan and is deemed creditable by Medicare, meaning its base coverage is the same as you would get on Medicare. As long as those two things are in play, you don't have to do anything when you turn 65. You'll have a special enrollment period later on down the road. First, let me tell you, if you are on a group plan, a small group plan with less than 20 people, when you turn 65, you're definitely going to want to get on Part A and B of Medicare at very least. Because if you don't, you will start to accrue late enrollment penalties, which we'll go over in a few slides, and you won't have full coverage in the meantime. So even if it's a very robust plan, that small group plan that you're on, doesn't matter. Medicare doesn't consider it to be creditable, so you're going to want to go on. Now, let's say you're in a larger group plan and it is creditable. Well, what happens? Well, you have the special enrollment period that you can get into Medicare when you retire. Let's say you retire at age 68 or at age 70. Well, at that point, you have 8 months from the time you lose your work insurance to get on Part B of Medicare without penalty or delay or health questions. And you have 63 days to get on Part D from the time you lose your work insurance without penalty or delay. Yes, drug coverage is treated a little bit differently when it gets to Medicare. Not everything's automatically together. But the rule of thumb is you're going to want to get into Medicare, into a plan. Most people do have their drug and health benefits combined. You're going to want to get into Medicare plan within 63 days of losing your work coverage when you retire. Yeah, you can do it before you retire. You can coordinate it about a month and a half before you retire to make sure there's a seamless transition. But you have some time if you miss that opportunity to get in without penalty or without delay. It's called a special enrollment period. What happens if you don't get in on time? What happens if you didn't realize that your plan was not creditable or you didn't know? None of you are hopefully at risk of that because you're on this webinar tonight. Well, if you miss those deadlines, you may, for one thing, have late enrollment penalties. And this is how it works. You would be penalized for Part B and possibly Part D. There's a lot of our when we do in-person workshops and when we get comments on these webinars, a lot of people think that they would be penalized for Part A. No, there's no penalty for being late to Part A. There's no such thing. But for Part B and D, there are. And for every 12-month period that they think you should have been on Part B and you weren't, you're going to get a 10% penalty based on the base monthly premium for Part B. For example, if in 2024 you should have gone on Medicare and you didn't, and now you want to go on Medicare in 2026, you will have a 2-year penalty, which is 20% of this year's base premium, $202.90. So you would have a $40.58 monthly addition, monthly late enrollment penalty to your Part B premium. So you're paying that every month, that extra amount. For Part D, it's different, but the same. You would have a 1% penalty starting day one. And in this same scenario, it would be a 24% penalty because we're talking about a 2-year example. They base that penalty on a base premium that the government comes up with. In reality, monthly premiums for drug plans can vary tremendously. In New Jersey, from $4.40 all the way to well over $100. But the government has to come up with something to penalize you on. So this year, the base premium that they've come up with is $38.99. So 2 years late to drug coverage, you'd have 24% on $38.99, which is $9.36 extra on top of whatever your drug plan premium is. Now, two things that you need to note here. One is that because these base premiums go up every year, well, so do your late enrollment penalties. And two, they never go away. They are permanent penalties. It doesn't last for a month. It doesn't last for a year. These penalties will follow you for the rest of your life, or at least the rest of the time you're on Medicare. If you decide you want to move to Spain, then you don't have to worry about it. So very, very impactful. You're not going to be charged with a late enrollment penalty because you're here now. COBRA is not creditable as far as Medicare is concerned. If you're going to coordinate your retirement with your 65th birthday, don't do it with COBRA. Individual exchange plans, Obamacare, ACH, Get Covered New Jersey, call it any of those names, that is not creditable. They don't want you to stay on those plans anyway, but if you did, you'd be in trouble. And some employer plans, including the ones that are over 20 people on it, some of them are not creditable. If you want to stay on your employer plan and not get into Medicare, and you want to defer that for down the road, you got to make sure with your employer or your spouses that the plan you're on is creditable, so you don't have any surprises. And they will give you a letter or some kind of a documentation, and you should request that every year from the time you turn 65 till the time you do intend on going on Medicare. It's called a letter of creditability, and it gives you peace of mind to know that you're not going to be penalized or have any implications for when you do want to go on Medicare down the road. If you're already on Medicare, and it's important for you to know too when you make your initial decisions here, if you're already on Medicare, you can make a lot of changes every year during what's called the annual enrollment period. It is between October 15th and December 7th every year. Now, what can you do during this period? You can change from a Medicare Advantage plan to a different Advantage plan. You can't do that all during the year, but you can do that now. If you're on an Advantage plan and you want to drop it and go to original Medicare, you can do it at this time of year. You may not be able to get into a Medigap plan if that's what you decide to do, which I will explain in a second. But you can drop a Medicare Advantage plan during this period of time. If you're on an original Medicare path and you have that standalone drug plan and you had a expensive prescription that was given to you during, May or July in the middle of the year, well, you can't change your drug plan whenever you want. You do have a lock-in period. This is when you can say, hey, is there another drug plan out there next year that covers my Eliquis that I got in May better than the plan I'm on now? And if there is, you can switch. This is the time of year that you can do it. Now, if you start out in a Medicare Advantage plan, and in 2 years during the annual enrollment period, you decide, I want to do the Medigap thing. Whatever your reasoning is, you want to switch to go to original Medicare and you want to pick up a Medicare supplement plan. Well, at that point, the Medicare supplement company can and will ask you health questions. And there's a chance that if you have a condition or a combination of conditions that they don't like, that they will either say, no, you can't come on board, or they're going to raise the rate to a much higher rate that in some cases is unaffordable for a lot of people. So there's a risk if you start out in Medicare Advantage, even if you're healthy right now and you don't even take any medications, there's a risk to some level that if you start out in a Medicare Advantage plan and you move or you want to move to a Medicare supplement plan later on down the road, that you might not be able to get into one. So if you have to answer health questions, you're not, you don't have to be a marathon runner. They can accept you, but just be aware of the fact that they may not.
All right. So we're going to talk more about these Medigap plans. in detail, okay? So the next few slides are just about these Medigap, also known as Medicare supplement plans. And these plans are also identified by letters, just like the parts of Medicare. And some of the letters are the same exact parts. Excuse me, some of the letters of the plans are the same letters as the parts of Medicare.
Confusing.
It confuses us a lot. Now, the good thing is that these Medigap plans, the most popular ones that you're only really going to need to consider, are different letters, and those are Plan G and Plan N, as you can see highlighted in the green. Something important to note is that these plans are standardized, meaning that a Plan G offered by one company is the same exact coverage as a Plan G offered by a completely different company. Same with Plan N. You go to the same doctors, you get the same coverage, no matter the company that you're with, okay? So there are 15 different companies here in New Jersey that offer the same exact federally standardized Medigap plans. Again, Plan G is Plan G. Plan N is Plan N. It doesn't matter the color of the logo. It doesn't matter the name of the brand. It's the same exact offering. Same doctors, same coverage. But how do you know which company to choose? That's what brokers do, and we discuss that with you. But also you can take a look yourself. And what we take a look at is, first off, you want to know the starting rate of the plan. You will have to pay a premium, and you want to make sure that you're not paying too much to start off, especially when you don't have to answer health questions. You also want to know that they are treating their current beneficiaries with respect. You don't want them to rip you off by raising your rates. Your rates will raise every single year, no matter the company, but you want to make sure that they're treating their current beneficiaries with modest rate increases. You don't want to join a company just because of the big brand name, even if they raise their rates like crazy. There are some big brand names out there that do that, and we would recommend not going with them. And then 3, you want to make sure that the company has a good financial rating. Of course, right? You want to get involved with a company who is healthy financially. Let's talk more about these plans. So these Medigap plans, they work with Original Medicare. Original Medicare Parts A and B lead the way into the door of the doctor and the hospital. And then this Medicare supplement policy does what it sounds like it does. It supplements Original Medicare. It fills in the gaps. It pays some of, if not all of the deductibles, co-pays, and co-insurance that Original Medicare doesn't cover. So those scary numbers on the Part A and Part B slides in the beginning of the webinar here. You have to pay an additional monthly premium for these plans, like I mentioned. So you're going to be paying Part B, which is $202.90 for most people. And then you're going to be paying an additional premium for this plan. You don't have to worry about networks because A and B leads the way. 97% of providers in the country take Medicare. So they're going to take your secondary plan as well, no matter the company. I mentioned this a few times, and I'm going to say it one last time. These plans are standardized. I don't want you paying more for the same exact plan. It's like buying Coca-Cola from Wawa versus from Yankee Stadium. You know where you're going to be paying more, but it's the same ingredients. There's no maintenance for these plans. You don't have to worry about the plan changing from year to year. Yeah, your rate will go up, but your coverage is going to remain the same. Your cost is not going to increase because of your healthcare needs. Your costs are fixed, and your premium isn't going to go up because you are sick. They will spread the pain with all the people that are in the plan, but you're not going to be punished because of your health. And there are no pre-authorizations or referrals. That's the rule of thumb generally. However, there's a new pilot program where in 6 states, they will require pre-authorizations for 17 rare treatments. New Jersey is one of those 6 states. But again, the general rule of thumb is no pre-authorizations, and you may need them for 17 rare treatments. All right. Let's move along. We're looking at this puzzle here. We're going to talk about what these plans, Medigap plans, actually cover. By the way, guys, at the end of the webinar, you're going to have an opportunity to get this this pamphlet here, this outline of coverage, along with a summary of the workshop. There's going to be a survey. It takes like 30 seconds to do. So it'll pop up at the end. If you do that survey, I'm going to get this over to you tomorrow. This outline of coverage and a summary of the workshop. Okay. So fill that survey out. It takes like a minute. So let's talk about what Plan G covers first. If you are using your Part A hospital coverage, right? You go inpatient to a hospital and you have a Plan G. Well, you are not going to be paying for your deductible. Remember that deductible, $1,700 and change, that goes away. So whether you're in the hospital for 1 night or 60 nights, you're not paying. And then there were those daily deductibles from day 61 all the way to day 90. You're not paying for those either. Those daily deductibles are covered by Plan G. And remember, original Medicare gives you 60 lifetime reserve days in the hospital if you're there for over 90 days. Well, a Plan G gives you an extra 365 days in the hospital. So you can basically be in the hospital for like a year and a half and not pay a dime if you have a Medicare supplement plan. Now, if you're discharged and you have to go to a skilled nursing facility, original Medicare only gives you 20 days for free. And then you have daily deductibles all the way up to day 100. Well, a Medigap plan, a Plan G, will cover you in full for those remaining 80 days. So you could be in a skilled nursing facility for 100 days and you're not going to pay a dime. Those daily deductibles in a skilled nursing facility go away as well. Now, outpatient, if you are using your Medicare and a Plan G, you first have to get through a deductible. It's the Medicare Part B deductible, which is $283. You guys probably remember that from earlier. That's a small deductible. Once you pay that and you have a Plan G, you're done. You don't have any copays for a doctor visit, for lab work, for tests, treatments, MRIs, surgeries, hospital, remember? Nothing. Outpatient, you pay the deductible and then you're done. Now, Plan N is very similar to Plan G. Inpatient, Part A of Medicare, it's the same. You get the 365 extra days. You don't have to pay if you're in the hospital. Skilled nursing, you get 100 days. So Plan G and Plan N are the same exact coverage inpatient. They differ a little bit outpatient with the Part B care in Medicare. So you still have that deductible of $283. And then there are 3 differences, okay? You have $20 copays at the doctor's office. That's only for visits and follow-ups, and it won't be higher than $20. It could be lower, but it's not going to be higher than $20 for a copay. You will also have a copay if you go to the emergency room, and that will be $50. And it doesn't cover a very rare fee called an excess charge. I don't want to get into that, but it's so rare. Only a tiny percentage of Medicare providers can charge it, and only some of those providers even do charge it, and that averages to be about $20. So it's not much of a factor, but it's there, so you have to know about it. Now, because Plan G covers more, it's more popular, but Plan N is about $40 to $50 less per month. So there's a lot of value in that as well, but both of these plans are great. Now, let's talk about the Medicare Advantage. We're shifting gears here, and we're going to talk about the other way to be in Medicare. Medicare Advantage, also known as Part C of Medicare. Now, in 2026, there's 7 different companies that offer 44 different plans. All 7 companies have different doctor networks. Some of the plans that one company offers may have different networks as well. And they all have different copays, costs, and benefits. So basically what I'm trying to say is there's 44 unique plans here in the Medicare Advantage world. Now, let's talk more about them. So all the different parts of Medicare are rolled into one plan. You have Part A, Part B, and Part D rolled in together, bundled together, and they call it Part C of Medicare, also Medicare Advantage. Now, you still have to keep Part A and Part B to be enrolled in an Advantage plan. You still have to be in Medicare, but this private insurance company is going to take over. The private insurance company that you're getting the Advantage plan from is now facilitating your entire insurance. They take over. The original Medicare card, you can keep it in the kitchen drawer, and you're going to show them the Advantage plan card with the private insurance company's name on it at the doctor, the hospital, and the pharmacy. All right. So a lot of these plans, well, all these plans, they have doctor networks. Some of them are PPOs, some of them are HMOs. Now, the market in Medicare Advantage is shifting, and they're shifting away from PPOs. The insurance companies started losing money, or they weren't making as much money as they wanted in PPOs. So they're pushing people out of those plans, and they're making them less feasible to get. They're raising premiums, they're lowering benefits, they're making copays higher, and they're sometimes outright just dropping the PPO plans. So there's a lot of HMOs out there. And if you're going to think about a Medicare Advantage plan, I want you to wrap your head around the idea that you may have to be in an HMO. If not this year, then down the road, you may be. I don't have a magic ball here telling me what's going to happen in the future with these Advantage plans, but I want you to understand that you may have to be in an HMO because over the last few years, this is the trend that these Advantage plans are going in, all right? Now, I mentioned that these plans come with Part D drug coverage, which is great if you're on drugs because you have that drug coverage in the plan. And it's great if you don't have drugs because you're avoiding late enrollment penalties by having a Part D plan built in to the Advantage plan. So you don't have to pay anything more to avoid the late enrollment penalty. Now, I mentioned they come with extra benefits like dental and vision. Some of them come with over-the-counter benefits that'll help you pay for vitamins, toothpaste, things like that. And some of these plans are $0 premiums. Again, a little bit less likely this year than last year that you can get it $0, but there's definitely a handful of plans out there that we like that are still $0 premiums. So you don't have to pay extra to get the extra coverage that this gives you. What do the costs actually look like? What do the copays look like in an Advantage plan? We're going to look at the likely column here, all right? So the one that's highlighted in dark blue, and it says likely. I mentioned the monthly already. Could be $0, could be 30 or 50 bucks, something around that also. It depends on the plan. The maximum out of pocket, what that is, let me explain what that is a ceiling of protection. So if you have a bad medical year and you're in and out of the hospital, maybe getting treatments, maybe getting surgeries, and you spend a lot of money out of your pocket, this maximum out of pocket acts as a ceiling of protection, and then you don't have to pay for the rest of your care for the rest of the calendar year. So if you spent $92.50 out of your pocket in an Advantage plan, then the company is going to kick in at 100% for your coverage the rest of the year. A hospital stay could be about $23.40. Could be $2,000, could be $25,000. It depends on what insurance plan you choose. Now, the structure of these costs are a per night fee for a certain amount of nights. So it could be $400 a night for 5 nights or $450 a night for 6 nights. So let's say you're there for 1 night, you pay $450. If you're there for 2 nights, you pay $900. And if you're there for 6 nights, you'll pay whatever that math is. You could be $23.40. And then you're not going to pay for night 7, 8, 9, 10, etc. Now, a primary care doctor should be $0. A specialist visit could be about $45, maybe $55, maybe less. Lab work, diagnostics, x-rays could be about $35 too. So depends on the plan, but these are what these numbers generally look like. Now, what are the steps that you take to get on the Advantage plan? Because there's a lot of due diligence. There's 44 different plans, and I promise you that the mailer that you open today may not be the right plan for you, or the cold call that you're getting may not be the right plan for you. These are the steps that we take our clients through.
Don't forget infomercials.
Infomercials too. Do people watch those? I don't know. Yeah. But that's like when the football game is on, and then there's something on after you forgot the TV was on. Anyway, so so these are the steps we take our clients through when we are looking for an Advantage plan. You could do this as well. Take a screenshot. All right. Get a list of your prescription drugs. Those aren't going away. We need to make sure that the drugs are covered in the plan, that they're on the formulary, and that they're covered at the right rate, right? You don't have, why are you spending more money for your drugs than you have to? Let's get those costs as low as we can. Then let's get a list of your providers, right? And your hospital. So where do you need to go for your care? We're never going to ask anybody to change that. You go to the doctors you trust. You should keep them. Step 3, compare the copays. Line them up side by side. How much does the specialist cost? How much is the hospital? How much is the primary care doctor? Step 4, let's look at the extra benefits, right? How much dental is this plan giving me? How much is this one giving me? What are the vision benefits? How much over the counter are they giving me? Which one comes with gym membership? And then step 5, just really understand what you're doing when getting in an Advantage plan. Like I said, the market is shifting. You may need pre-authorizations. The private insurance company is in charge, and they can tell you no. You're going to have to stick to the doctor network. And the doctor, they may drop the plan in the middle of the year. So just really understand the Advantage plans. We're not saying don't do it. We still write Advantage plans. We have many clients on Advantage plans. But just understand where the market is going and the risks that are involved. All right. We're at the point of the presentation where people go, dude, I don't even know what you're talking about. Just how much does it cost? So that's what I'm going over right now. Now, the first thing to say is that the blue is Medicare Supplement and the green is Medicare Advantage. The first 2 line items are the same across the board. So where it says Medicare Part A and Medicare Part B, that's your ticket into Medicare. That's not going up or down depending on which plan you choose. It's just that's your ticket in. So $0 for Part A as long as you or a spouse have worked 10 years or more paying taxes. And Medicare Part B is $202.90, assuming that you have the average income of the average American. So let's look at the Medigap first. They rate these plans based on age and gender. Males are a little bit more expensive than females, and of course, the rate goes up as you age. We're looking at Plan G here, not as a recommendation, just as an example because it is popular. You could be in a Plan G as a female that's 65 for about $157. That's a pretty low rate. You can get in maybe a little bit lower than that. You can definitely get in a lot higher, especially with some of those big brand name companies you guys are thinking about. You can get into Plan G as a male, 65-year-old male for about $174. Again, that's pretty low. You could definitely get in a lot higher. For your Part D drug coverage, we don't know exactly what your drug plan is going to cost until we get a list of your medications, but we're going to assume here that it's $22.80. So you could be all in as a female with a Plan G and a drug plan for $382.70, and as a male, $399.70 per month. What are your variables? Well, not when you go to the doctor, because you know that you just have that $283 deductible, and then you're done. No copays in the hospital, no copays at the doctor for anything. But your variables are in your prescription drugs, because if you get a new drug in the middle of the year, say July, you can't change the drug plan until October, and all the changes you make will take effect in January. So you can't change the plan until the next year. So you might have to eat the costs if your current drug plan isn't the best for that new medication. All right, let's look at the green, the Medicare Advantage. Again, your ticket into Medicare is $202.90. And in the Advantage space, it's likely to stay that on a hard monthly cost. Again, there's a few plans out there that we like that have monthly premiums, so we may talk to you about that, but you can get in for $0. But what are your variables? Well, everything you do. Are you going to the doctor? Are you getting a new prescription med? Because that's also wrapped into this plan. Did you end up in the hospital for a few days? You might have a $2,000 bill. So your variables and the advantages are everything you do, basically. So that's the risk, but you're paying less, and it comes with extra benefits. So there's pros and cons in both.
All right. So earlier we talked about the extra surcharge that you would have to pay if you have an IRMA charge. Remember, that's income related monthly adjustment amount. There's always a 2-year look back, meaning for these IRMA charges, they're looking at your tax returns from 2024 to determine whether you're going to pay extra. And if you are going to pay extra, it's possible on Part B and on Part D. Your modified adjusted gross income on your tax returns is what they're looking at. So that's adjusted gross income with certain deductions added back into it. That's how they did come up with that. Now, here are the income bands. So in 2024, if you filed as a single filer and you made over $109,000, or as a couple and you made over $218,000, they just double it, you're going to be in your first IRMA category. And then that means that your base rate for Part B is no longer $202.90, but there's an $81.20 addition to it, to where your Part B is now going to be $284.10. And that would be for each of you, if you're both on Medicare. Also, in your Part D drug plan, you would have an extra $14.50 per month to pay for your drug plan, on top of whatever your drug plan premium is. And that could be zero. If you have your drugs through a Medicare Advantage plan, it would be zero. But so now these are these income bands. It goes very high. I think Ethan said he was always going to be at the lowest one there, and that's where his IRMA is going to come into play. But in any case, we do this. This is a factor in a lot of people's planning.
The lowest meaning the highest.
The lowest meaning the highest.
That's what he means.
Yeah. Well, I mean on the bottom of the page, but it is a factor. We help a lot of our financial planning clients, deal with this in one way or the other. There may be a reason why 2 years ago your income was a lot higher than it is now, or maybe it was a house that was sold or a business that was sold, inheritance. There are ways to appeal it. It may, if you have a good reason, it may come down, but this is what you'd be facing. And these are the numbers this year. These numbers also change from year to year, usually on your benefit, because they will increase the thresholds based on the cost of living and other factors. And so just to give you an idea of what these IRMA charges would be. Now, I'm going to just talk for a minute about using an independent agent. And the key word here is independent. Ethan and I at Senior Star, we don't work for an insurance company. It might sound tacky, but we work for our clients. We work with all the insurance companies, though. We have those contracts with all the big brand names that you've heard of, a bunch of that you haven't heard of. And what we do is we take our clients window shopping. And that's what you want. You want somebody that's going to educate you, inform you, guide you, but not make your decision for you, and look out for your interest, not ours. Where our goal is to create long-lasting relationships so that as time goes on, you're going to use us the next time you need a change, and you're going to refer people to us. You may come to us for financial planning one day. We're looking to build relationships, not to make more money on one transaction, which is the opposite of a lot of the call centers and a lot of the flyers that you're getting in the mail. So that's the benefit of using an independent agent. We also provide you with a lot of customer service after the policy is in force. A lot of what we do is answering questions, communicating with people after we've already written a policy, and keep you abreast of things that are going to change in Medicare. Hey, you may want to look at a different drug plan next year because the cost of such and such is a lot more, or the premium in the drug plan that you're in now is going up by $50 a month, etc. So we keep you abreast of changes. We're not the kind of agency that just writes a policy and disappears, and there are plenty of those out there. So we don't cost you anything. Big issue. We do not charge a fee for anything we do. It would be unethical and illegal to do that. We do get charged. We do get paid a commission. We do make a living, but it's with the insurance carriers that pay that commission. And we don't have a preference. As I said, our goal is to build a relationship with you. Now, there's a lot of changes in Medicare. And one of the reasons you also might want to talk to an agent that you can, talk to and trust is because even in the last 2 or 3 years, as agents, we've seen tremendous change in Medicare products and Medicare drugs. There's a lot of moving parts. I'm not going to go over each one of these things, but basically, because of legislation that was passed in 2022 relating to drug coverage and costs, and rising medical costs that these insurance companies are having a struggle with and not anticipating, not planning for, there's a few reductions of services. So it affects mostly the standalone drug plans and the Medicare Advantage plans. Sometimes they remove plans from the market. That happened to us this last annual enrollment period, where we had to re-enroll many people that were in a plan that the company decided just to take off the market. Most of this is happening with PPOs. They're charging premiums on the PPOs. They are making it harder to go out of network with deductibles and other costs in these Medicare Advantage plans if you're in their PPOs. So we just want to make you aware of it. We are not negative on Medicare Advantage plans in general. We are happy to enroll people in it. There are people where these plans make the most sense. There's not an additional premium or a smaller premium in some of them. People have already been used to networks. We just want you to know that there's some changes, but it's good to have an expert to tell you about that. Finally, the part that Ethan was telling you about for original Medicare. Right. So if you're on an original Medicare with a supplement plan, there is this prior authorization called WISER. It's at the very bottom of the page, which is a pilot program. Yeah, New Jersey is one of the 5 or 6 states that this is being implemented in. They have identified 17 procedures that they think are rife with fraud that are going to require prior authorization, even in original Medicare. Now, it doesn't mean you won't get it. It just means you might need permission. So all of these things factor in to your decisions, and it can be scary to navigate this stuff alone. So we do advise you to use an independent agent. We hope you use us, but if you don't, we want you to get the help somewhere. Your mic is off.
Good. Thank you. Sorry about that. So we're wrapping up here. By the way, I just put a link to our calendar in the chat there. So if you guys wanted to book a call just to make sure you guys are on the right page, click the link in the chat. We could schedule something that way. All right. So if you are collecting Social Security, then you're actually going to get your Medicare card sent to you 3 months before you turn 65. Again, if you are collecting Social before you're 65, you actually don't have to apply for Medicare A and B. They're going to send you your card. If you don't want Part B, then you're actually going to have to reject it. Okay? Now, if you are not collecting Social Security, you have to knock on the door and apply for Medicare. You can do that at ssa.gov. The most difficult part of that process is creating a My Social Security account. So if you already have a My Social Security account, then you don't have to worry about it in terms of the difficulty of it. It's pretty simple. We also send our clients step-by-steps on how to do this application online. Now, if you like torturing yourself, there's the 800 number for Social Security. Sometimes you got to call them, but we try to avoid that. And you could also try to pop in person at the office and see if you can get a walk-in. It's difficult to schedule an appointment, but if you do schedule an appointment, they might make it a few months out. But those are the 3 ways to do it: online, over the phone, in person. We recommend online. Well, what's next, guys? Well, first off, thank you for coming. And if you have questions, put them in the chat because we're about to get into a Q&A. When this workshop ends, there's going to be a survey that pops up. If you fill it out, you're going to get a copy of the outline of coverage for the Medigap along with a summary of this. It's a 12-page PDF. And again, this survey takes, maybe a minute and a half. So I think it's worth it for you to stay to the end and just fill the survey out just to get that. And we will give you something for it. You can join our newsletter if you'd like. It's once a month. It's not spamming you. It just gives you retirement updates, Medicare updates. It tells you some stuff about the season that we're in and just some cool updates there. And here's our contact info. So if you guys need anything, this is us. Questions about Medicare, questions about your current coverage, whatever it is, if you just want to feel a little bit more comfortable about this process, we'd love to work with you. And we're really happy that you guys joined today. So it looks like there's some questions in the Q&A here, but keep them coming, guys. So I'm going to start off. So Alex asked, can you have both Medicare Advantage and a Medicare supplement plan?
Good question, but no. You can't have both at the same time. Now, it's possible to switch. We talked about those periods and the annual enrollment period, and it may be possible to go into a supplement plan after the fact if you're healthy enough, but you can't be on both at the same time.
All right. Diego said, is this webinar recorded and can you send it to me? Yeah, the webinar is recorded. I could get it to you if you fill that survey out. And if you just put in the notes section of the survey that you want me to send it to you, and I'll give you a copy of this for sure. All right. Jen asked, what happens if you need home health care or need to be in a nursing home?
If you need home health care or you need to be in a nursing home, that's not medical insurance. It's actually going under something called long-term care insurance. It's definitely important to get coverage for that, but it's not something that Medicare is going to help you with. It's a factor. It's something you need to look into, but it's separate. If you're in a longer term, we talked about skilled nursing facility, anything medical that's related to an inpatient stay, yes, but not nursing home or any kind of long-term living situation.
All right. Sue asked, does Medicare supplement come with dental?
No. Original Medicare supplements do not come with dental. You'd have to get that as a standalone plan on the side. You can add to that original Medicare platform that you have, those products that you have. It's going to be another card and it's going to be another monthly premium, but you can do it. It doesn't have to be part of your Medicare plan. It can be an outside plan.
We have another question here from Doug. How much will Medicare supplement rates increase every year?
That's a very complicated question, Doug, and it's one we cannot answer, with any kind of accuracy. The rates go up by the company's risk level as well as other market factors. If you're in a company that more people are going to the doctor and making claims, that, as Ethan said, that they're going to spread the pain and everybody's rates are going to go up. Some companies, when they're allowed to ask those health questions, the Medicare supplement companies, they're going to ask tough questions. And if you have, a few conditions that they don't like, another company may say yes to. They would say no. They try to keep their rates down that way too. But nobody knows for sure when you're turning 65 or when you're coming off of a work plan, they cannot ask you health questions regardless of your health. So even these insurance companies can't figure out what they're going to be charging next year and the year after. The rates have gone up a little bit faster lately in general. They used to go up 3 or 4% every year. Now they're going up closer to double digits. There are some big name companies, which I won't mention, that have had double digit increases in their rates lately. So that's another thing that you can talk to us about specifically when you're doing your planning.
We got a question in the chat here from John. Any examples of the 17 procedures that may need pre-authorizations in original Medicare?
There are. I mean, they're published. We can send you a link to that. We can communicate with you. I don't have every one of them handy, but we will get that to you, John.
It's things like, epidurals and wound care. It was a lot of pain management sort of things.
We'll get you the exact ones, though.
If you go in the chat, I may actually made a YouTube video on this. So I just dropped the link to that as well.
Okay.
So if you want to watch it, we have the list of the 17 in there as well, John. Okay. So you could click that link.
There's another question. It looks like in
the Q&A. It seems like Advantage plans have a cap of $9,000 per year. How about Medigap?
Medigap doesn't need one. If you remember, Medigap has a monthly premium. It works with Original Medicare to cover your costs. So the only factor that's coming out of your pocket is that deductible for Part B. That's $283. Then your ceiling is the same thing as the floor there. You know what you're going to be paying in a Medigap plan. Now, again, you're juxtaposing that to being in a Medicare Advantage plan where you might not have anything to pay per month. So it's a balancing act that you have to decide for yourself. But if you're in a Plan G with Original Medicare, you know what you're paying for your medical insurance that year. There's no maximum out of pocket needed.
Yeah. Well, it looks like that may be it for the questions. So if anybody has any other questions, again, we're here for you. Feel free to give us a call. I'm going to drop the calendar link in the chat again one more time if you guys need it. And yeah, the survey is going to pop up here in a moment when we end the webinar. Again, it takes a minute. We thank you for doing it in advance, and you're going to get something for it. So we appreciate you.
Great turnout tonight, guys. We hope we helped you and answered some of your questions. Stay in touch, and we'll answer more. And have a great night. Stay warm.
All right. Take care.
Bye-bye.